A new report shows dozens of Texas hospitals are at risk for shutting down. Some of those reasons include inflation, fewer people heading to the hospital, and staffing. Our Tahira Rahman sat down with one organization to get some insight on what that means for smaller communities if hospitals start closing their doors.
1 in 10 hospitals in Texas are at risk of closure. What would it mean if some of these rural hospitals have to close?
Two things. It means no access to care in those communities, unfortunately. But in a broader sense, it also means that there will be a lack of economic development related to access to health care when people just don't choose to live in a community where they can't access care, or have a baby, or activities like that. So what we find in most rural communities is that the hospital is an anchor for economic development all throughout the community. So the hospital closes, the pharmacy closes, the grocery store closes, and then the community just kind of falls down.
Emergencies, you mentioned things like having a baby or even going to the ER. What does it mean if these hospitals have to close for emergencies in rural areas? Or is non-emergency hospital care a bigger concern, a larger concern?
No, I would say emergency care is the biggest concern. And the data shows that actually after a rural hospital closes, mortality rates increase by 8%. So it's a danger to the community, especially when you're having a heart attack or a stroke or a loved one is going through that. With regard to non-emergency services, that's important too: primary care, obstetrical care, and when those things fall down, the community suffer.
Does needing more time or taking more time to get to a hospital put people at a higher risk of dying?
Oh, for sure. We talk about the golden hour in healthcare, and you can't necessarily say in every case how it's going to turn out. But the further you are from healthcare, when you have a health event, the worse your chances of survival are.
Do rural hospitals closing mean more helicopter services, more ambulances that use more gas, resulting in higher bill for people in rural areas?
Yes, that's exactly right. When you have a rural hospital close, there's more reliance mostly on the ground ambulance service and EMS service, but also the helicopter services, telemedicine services, and things of that nature. So there becomes a travel burden for sure among these rural communities when they no longer have access to healthcare.
Compassion fatigue and depression are just two things nurses who work in our local hospitals say they are dealing with. And today we're taking a closer look at how the impact on their mental health is affecting our hospitals. Some nurses tell us things like staffing ratios and work conditions have brought things to a tipping point the last few years.
The empathy part of your brain that you are using to meet these patients where they're at and help them emotionally, that becomes drained, and then you can no longer care at the same level that you used to.
Yes.